Did you know that up to 65% of stroke survivors experience difficulties in swallowing? This condition, also known as dysphagia, is prevalent among those who have suffered a stroke. It's an often overlooked but significant hurdle in the journey to recovery. Think about it. Something as simple and automatic as swallowing becomes a challenge, like relearning to walk, but inside your throat. Research shows that dysphagia can affect more than just the physical aspect of recovery. It can have profound implications on the emotional and social well-being of survivors, impacting their confidence and interaction during mealtimes. It also poses health risks such as malnutrition and dehydration, and can even lead to serious complications like pneumonia. This is why understanding the prevalence of dysphagia is crucial. Dysphagia is not an isolated issue, but a common one, faced by many in the stroke recovery process. So, it is safe to say that those with a swallowing difficulty after a stroke are not alone. So what causes the swallowing difficulty? It all starts with understanding what happens during a stroke. A stroke occurs when there's a disruption in the blood supply to the brain. This can cause damage to certain areas of the brain that are responsible for controlling our swallowing function. Now, swallowing might seem simple, but it's actually a complex process that requires the precise coordination of numerous muscles in our mouth, throat, and esophagus. When a stroke damages the part of the brain controlling these muscles, it disrupts this coordination. This can make it difficult for stroke survivors to swallow, leading to potential choking, aspiration pneumonia, or even malnutrition. Imagine trying to conduct an orchestra, but some musicians aren't playing in harmony. That's similar to how a stroke can disrupt the symphony of muscles involved in swallowing. Therefore, the cause of swallowing difficulties post-stroke lies in the damage to the brain and the subsequent lack of coordination of the swallowing muscles. Now you may ask, how can we address these swallowing difficulties? This is where speech and language pathologists step in. They work tirelessly behind the scenes to assist stroke survivors in regaining their swallowing abilities. These experts utilize various methods, such as exercises specifically designed to strengthen the muscles involved in swallowing. Additionally, they provide advice on dietary modifications, which can have a significant impact. For instance, changing the consistency of food and liquids can make swallowing safer and simpler. They may employ interventions like electrical stimulation or thermal tactile stimulation to enhance swallowing function. Each therapy plan is tailored to cater to the unique needs of the patient. It's important to note that the objective of this therapy isn't solely focused on swallowing. It aims to improve the overall quality of life of stroke survivors. With the guidance of these professionals, stroke survivors can strive to overcome their swallowing difficulties and better their quality of life.